Hello and welcome to the RICU. I'm Daniel Fuchs.
And I'm Stephen Gams.
This is the RICU, where we keep you up to date on all the latest in clinical research. We know how busy you all are as med students and residents. It's sometimes hard to keep up with the latest literature. So we're here to review recent research articles from top-tier medical journals to keep you up to date. Without further delay, here's today's episode.
This week's article is from the New England Journal of Medicine, published on May 26, 2022.
So it is hot off the press.
Yup. It's about neoadjuvant nivolumab plus chemotherapy in resectable lung cancers.
Let's get a good understanding here. Stephen, what is the first thing that comes to mind when I say lung cancer?
The first thing I think of when I hear lung cancer is smoking. Smoking is a well-known risk factor, but of course, there's much more to it. There are many different types of lung cancers. There is a broad breakdown into small cell lung cancer and non-small cell lung cancer, which then have more subdivisions.
The thing I always think about when I think about small cell and non-small cell is Dr. Sattar from Pathomas Mnemonic to remember treatment options. He would say that small cell is too small for the surgeons to see, so no surgery is able to be done, as opposed to non-small cell, the surgeons could see those. But anyhow, back to our topic. This article is specifically talking about non-small cell lung cancer.
Sure. So the basic breakdown of lung cancer staging is actually a bit more complicated, but this article deals with stages 1B through 3A specifically, which basically means it's larger than 4 centimeters, but has no distant metastatic sites.
Additionally, the specific chemotherapy involved in this study is called nivolumab, which is a combination of a platinum-based therapy and a fluoropyrimidine chemotherapy.
So just some vocabulary. I noticed that this article is testing a drug that is a neoadjuvant. I just wanted to remind all of the listeners what this means. Neoadjuvant means medication that is given before surgery in order to reduce the size of the tumor with the goal of making the surgery have a higher likelihood of success. This is as opposed to adjuvant chemotherapy, which means chemo after the surgery. So Daniel, what type of study was it and how did they do it?
Glad you asked. This is a phase 3 international open label randomized trial. So what they did was 358 patients were split up and either got adjuvant nivolumab plus chemotherapy followed by surgery or just chemotherapy followed by surgery.
What were they looking for as the primary endpoint for the study?
So they had 2 primary endpoints, either event-free survival or pathological complete response.
Alrighty, so what were the results?
The median event-free survival was 31.6 months with nivolumab plus chemotherapy and 20.8 months with chemotherapy alone.
Wow, okay, that's a large difference.
In patients with resectable non-small cell lung cancer, neoadjuvant nivolumab plus chemotherapy resulted in significant longer event-free survival than chemotherapy alone. Additionally, regarding the pathological complete response, the nivolumab group had a 24% response as opposed to just a 2.2% in the chemotherapy group alone. That is a big difference.
The addition of nivolumab to neoadjuvant chemotherapy did not increase the incidence of adverse events or impede the feasibility of surgery. I thought that was important to mention.
What all of this means is that more people in the group that also took the neoadjuvant nivolumab were cured. And they also had less recurrence. So it sounds to me like adding the nivolumab would be a good idea going forward.
And that's all we have for you today.
This podcast is for general information purposes only. This does not constitute the practice of medicine, nursing, or any other professional health care services, including the giving of medical advice. No doctor-patient relationship was formed. The use of this information is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Thank you to all of our listeners. If you have any questions or comments, please email us at thericuteam@gmail.com. Follow us on Spotify, Instagram, and Facebook at The Ricu Team. As always, thanks for listening.